So, in this video, we start with the anatomy of the middle layer of the eye. So, we have already covered in our previous videos the anatomy of the outermost layer of the eye, which comprised of the cornea, the sclera, and the limbus. The middle layer of the eye collectively has been given a name, and that is uvea. We've already talked a little bit about uvea in our basic introduction video, but in this video, we will be talking in a lot more detail. Okay. So as you can see, we already have the picture that we have already seen in our previous videos of the section of the eye, and basically we can see the different layers of the eye in this diagram. In this diagram we can see, and that is why I have purposefully used different colors. I have also given the heading of uvea in red so as to emphasize that in this picture anything that is red is the middle layer. So the entirety of the red layer is the middle layer. Why have I drawn in red? That also has a reason. That is because uvea is also called the vascular layer. The vascular layer of the eye. Okay. Now, uvea is the collective name for the entirety of the middle of the eye. Does that mean it has different parts? It does. What are the different parts of uvea? The different parts, let's quickly name them first. First comes the iris, then comes the ciliary body, and finally we have the choroid. Okay, so where exactly are these located? We have already drawn this once, but we are still going to do it again. Iris is basically this thing. Okay, in both places iris is this. Let's first label it and then we'll see it in the actual diagram of an eye, or rather an actual picture of an eye. We will see it later. So that is the iris. Then ciliary body is this entire thing. Okay, in both places, in both parts. Okay, this thing, this entirety of up to here is ciliary body. The remaining entirety, obviously I'm talking about the red portion, the red, not the white. White is sclera, we already know that. The red part remaining is the choroid. Okay, done. Now ciliary body is again divided into two parts, as is evidenced by the picture. If I zoom in, you can see that the ciliary body I have demarcated into two parts. One is this black dotted area. This is called pars plicata. And this non-dotted smooth area, this is called pars plana. Okay, so the pars plicata and the pars plana, that comprises of the ciliary body, or rather the ciliary body comprises of these two parts. Done. Now that we know of the basic structure of the middle layer of the eye, let's go into another classification. See, if I can go back, let's make another slide over here. See, there is another classification of the middle layer, which is the functional classification. The functional classification, so as of now what we just studied is the anatomical classification of the middle layer of the eye. There is another classification which is the functional classification of the middle layer of the eye. That divides the middle layer of the eye into three parts. What are they? Anterior uvea, uvea being synonymous with middle layer of the eye. Intermediate uvea, and as you can already guess, posterior uvea. Now let's correlate the functional and the anatomical classification together. Anterior uvea, if we were to correlate that to the anatomical correlation, then this is basically nothing but the iris and pars plana together. So the iris and the pars plana together, they are known as anterior uvea. This is the functional classification. Intermediate uvea is only, or did I say pars plana? I'm sorry, I've made a mistake over here, please forgive me. This is not pars plana, this is pars plicata. Pars plicata. Intermediate uvea is only pars plana. Okay, kindly don't make this mistake as I did just now. Posterior uvea, on the other hand, the only remaining part, choroid. Now, why is it important to know the functional classification of the middle layer of the eye? It's very simple. The reason is that the most important pathology of the middle layer of the eye is uveitis. Just like the most important pathology of the sclera was scleritis, episcleritis, so basically inflammation of the sclera layers. Just like that, uvea's inflammation is the most important pathology of uvea, and that is known as uveitis. And uveitis is very, very, very important. We will have multiple videos on just uveitis itself later. So when we will be talking about uveitis, we will talk about anterior uveitis, we will talk about intermediate uveitis, and we will talk about posterior uveitis. Now, they have been given different names. Anterior uveitis is also called iridocyclitis, because iris is a part of the anterior uvea. That is why anterior uveitis is synonymous to iridocyclitis. Okay. Intermediate uvea, intermediate uveitis. Intermediate uveitis, being the inflammation of the intermediate uvea, is also known as pars planitis. As simple as that. And posterior uveitis, keeping in with the same spirit, is also known as choroiditis. Choroiditis. Okay, very, very simple. So anterior uveitis, intermediate uveitis, and posterior uveitis, which are the inflammation of the anterior uvea, intermediate uvea, and posterior uvea respectively, and their separate synonymous names: iridocyclitis, pars planitis, and choroiditis. Very, very simple to understand if you understand this classification. Okay, so now we have talked about the functional classification of the middle layer of the eye as well. Now let's move on to talk about the independent, or rather single individual structures of the middle layer. We start with the most important one, that is iris. Now, iris, and I have already told this before as well, is whatever colored part of the eye that you see on the mirror is the iris. So basically, the first thing that I can already say about the iris is it is pigmented. Okay, it is part of the middle layer of the eye. We know that it is pigmented, that also we know. Now, another very, very, very important thing about the iris is it is a muscular structure. It is a muscular structure and a vascular one as well. So it is a muscular and vascular structure. Okay, as simple as that. Vascular we can understand because it is part of the middle layer of the eye, so obviously it's going to be vascular. Middle layer of the eye being the vascular layer of the eye. But muscular layer, this is very, very interesting. Why is it interesting? This means that iris has muscles that we will talk about shortly. This also has another correlation. What is it? See, if I jot down, this blue part is basically what? Iris. But you can see that there is this black hole present in the iris. That is nothing but the pupil. Pupil is basically the aperture in our eyes through which light rays travel through. Obviously, we need a hole for the light rays to travel through, so that they can be converged on the innermost layer of the eye, which is retina, to form the image. That is the basic physiology of eye, right? Pupil is basically the hole which is present, or rather the aperture which is present in the center of the iris. So if we were to go back to that picture, we would have said that this was iris, right? Iris is already labeled in this, and in between the iris, this aperture that is present is the pupil. As simple as that, right? Now, when we had talked about sclera, we had talked about the fact that that was also a fibrous structure, protective fibrous structure. Iris is also a three-dimensional, structure. So basically, iris and sclera have this in common, that is, their thickness varies at different parts. That means just like sclera, iris is also thickest and thinnest at some places. So again, we need to understand where is it thickest and where is it the thinnest. So what is, okay, we have to deal with it here in this picture. See, where is it the thickest? Let's first deal with that. So if I zoom in this picture, see very carefully. Look at just the iris, that is, look at just the blue colored part of the eye. You can see that the blue colored part of the eye has been thrown into different colors itself. So it is not a plain blue. It itself has different shades. If you look very carefully, you will be able to see, I'll actually erase the other labelings so that we are only focused on what we need to be focusing on right now. Now, look very carefully. Okay? See. Look at the part of the iris which is close to the pupil. This part. This part of the iris is a different color. Okay? And then there is a part of the iris over here which is of different color. They are all different shades of blue. So there is a part of the iris which is close to the pupil which is of different color in this diagram or in this picture. And then there is a part of the iris which is close to the ciliary body, which is away from the pupil basically, that is of different color. This part of the iris which is closer to the pupil is called the pupillary zone. The pupillary zone of iris. Okay, and this part of the iris which is closer to the ciliary body. How is it closer to the ciliary body? Let's go back to that picture over here. So basically I am saying that this over here is one part of the iris closer to the pupil. So basically the pupillary part of iris, and this part over here, obviously this is closer to the ciliary body, as you can see from this picture, right? So this part of the body or part of the iris is called the ciliary part or ciliary zone of iris. Okay. Okay. Now let's go back to this picture. So basically I'm showing you in great detail that there is a pupillary zone of iris and there is a ciliary zone of iris. Okay. In between them, iris again has a different color. The portion of iris in between these two parts is what we give a very special name. So in between the pupillary zone of iris and the ciliary zone of iris, the part of the iris that is present is given a very special name, and that special name is, let's use a different, that special name is collarate. Collarate. C-O-L-L-A-R-E-T-T-E. Collarate. So collarate is the part of the iris present in between the pupillary zone of iris and the ciliary zone of iris. As simple as that. Why are we talking about these structures now, because basically collarate is the thickest part of the iris. So the zone between the pupillary and the ciliary zones of iris is the collarate, and that is the thickest part of the iris. Done? Done. Now, that begs the question, obviously, what is the thinnest? Where is iris the thinnest? So thinnest iris is, let me first write it down and then I'll show you. It is at the root. So iris is thinnest at its root. What does root means? Root of iris. That is, let's go back to this picture over here. This over here. See very carefully. See, this is the part basically see, if I draw a line like this, okay, this is basically the part where the iris as a whole is attached to the ciliary body. So this is called the root of iris. So if I draw it again, I'll show you in a much more simpler way. So suppose this was the iris and this over here is the pars plicata. Okay, so this is where the ciliary body has started. So basically what I'm saying is this part where the iris is attached to the ciliary body, this is the root of iris. Okay, root of iris is where iris is thinnest, which means wherever a structure is thinnest, obviously that means that the site of detachment of iris is most commonly from its root. Okay, which means site of attachment of iris is most commonly from its root. And what is the name given for detachment of iris? It is known as iridodialysis. Iridodialysis. We'll talk about it in detail when we talk about different traumas to eye. So iridodialysis, the site of detachment, not attachment, detachment of the iris due to some kind of a trauma, iridodialysis, that is most commonly from its root, because iris is the weakest at that part. Done. Now see, I had said that the iris is a muscular structure. That means there are muscles in the iris. And why is this important? Why does the iris need to have muscles? See, I don't know if you have noticed this. You have probably noticed this at this point in your life, that our eyes have this very unique ability of adjusting the size of the pupil. Very, very, very important. Have you seen that in the dark, if you have ever noticed this, in the dark our pupils dilate. That is called mydriasis. We'll talk about it later. And whenever there is bright light thrown in our eyes, our pupils will constrict. Okay, so you can do it right now. Actually, you can go in front of the mirror and you can throw light on your eyes and you'll see that your pupils will immediately constrict. Your pupils will immediately become smaller. Actually, that's what I'm trying to say. So what is basically the pupil? The pupil is the aperture in the iris. So if the pupil is becoming larger or smaller, that means actually what is happening? The iris is as a whole contracting or expanding, which means iris has muscles, and that is why it's a muscular structure. This brings us to this very, very easy topic as to what are the different muscles in the iris. There are only two muscles in the iris, and it could not have been easier. Even you can guess them without knowing them. What are the two functions that our eyes, as far as the pupillary size is concerned, is doing? The pupils either they enlarge, they dilate, or they constrict. So that means there will be a muscle which will be used for constricting the iris, and there will be a muscle for dilatation of them. Right? So constriction of pupil is carried out by sphincter pupillae. Sphincter pupillae. Whereas dilatation of pupil is carried out by dilator pupillae. As simple as that. Okay, sphincter pupillae and dilator pupillae, as simple as that. So obviously pupil means something to do with the pupil, and yes, that is what they're doing. They're actually altering the size of the pupil. And sphincter means it's acting as a sphincter, so it's constricting. So it is doing what exactly? It is leading to constriction of the pupil. Constriction of the pupil has been given a special name. It is called meiosis. Just like that, dilatation of the pupil has been given a different name, that is called mydriasis. Mydriasis. Okay, mydriasis, mydriasis. So sphincter pupillae and dilator pupillae, these are the two muscles of the iris. Now the next thing that we need to know about them is their respective nerve supply. Nerve supply. So now think about it. First of all, can you voluntarily control your pupil size? That is the first question that you need to ask yourself. Can I, just like the fact that I can, throw my arms around, throw my legs around, raise my arms, twist my neck, whatever, I can do all these voluntary actions. But can I, by my voluntary will, really constrict my pupil, dilate my pupil? No, obviously not. So these are involuntary actions, which means that their nerve supply will be from the autonomic nervous system. Now, autonomic nervous system is sympathetic and parasympathetic. So which one is the sympathetic and which one is the parasympathetic component in this case? The constriction or the dilatation. So for this, my general rule for understanding, or remembering rather, basically understanding anything related to the sympathetic nervous system is, imagine yourself in some kind of an emergency. That is all. Then think about the organ pertaining to an emergency. So suppose you are trapped. You are in a fight or flight kind of a case. Would you want your eyes to be seeing more, or would you want your eyes to be seeing less? Would you want more light rays to be traveling into your eyes, or less? Obviously, I want more. I want as much visual impulse as I can gather, obviously, so that I can process it better, so that I can see better, so that I can see the threat better, right? So that means that dilatation of the pupil will be the sympathetic component. So this is the sympathetic nervous system. This is controlled by the sympathetic nervous system, whereas this is controlled by the parasympathetic nervous system. Okay. Now, parasympathetic nervous system, what are the cranial nerves which are actually concerned with the parasympathetic nervous system? We already know this. They are cranial nerves 3, 7, 9, 10. So one of these nerves is the nerve which is supplying the sphincter pupillae. Which nerve? Third nerve, oculomotor nerve. So basically, the oculomotor nerve, what it does? It gives an inferior branch to inferior oblique. Inferior oblique is one of the extraocular muscles, which we will talk about later. Inferior branch to the inferior oblique nerve. The nerve's name is not inferior oblique. The nerve's name is inferior branch to inferior oblique. This is the entirety of the name, right? This gives off another branch, and that is the main nerve, and which is short ciliary nerve. So basically, in short, if you have to remember, pun intended, you need to remember that short ciliary nerve is the nerve supply for sphincter pupillae. But I will recommend that you remember this entire thing. That is oculomotor nerve giving the inferior branch to inferior oblique, that giving the short ciliary nerve. Then in this case, sympathetic nervous system, what is the nerve? If this one is short ciliary nerve, this is long ciliary nerve, as simple as that. So if you remember the short ciliary nerve, you will automatically remember that the other one, that is a sympathetic component, is the long ciliary nerve. Done. As simple as that. Okay. So basically, we have talked about the iris. Now, let's go and talk about the ciliary body. There isn't much to talk about the ciliary body, and we have already talked about the different parts of the ciliary body. What were the different parts of the ciliary body? Pars plicator and pars plana. So, pars plicator and pars plana. Very interesting. These names have clues as to how these structures are arranged or how they look like, basically. So, if we go back to that picture, see, pars plicator and pars plana have been labeled in this picture, right? Pars plicator is known, or rather named so, because of the simple fact that this layer or this part of the ciliary body is thrown into plications. Plications means folds. You can see, right, that there are folds here. However, pars plana being a plain structure, no folds present, it is pars plana, plain. Okay, as simple as that. So that is pars plicator and that is pars plana. Now, some interesting things. See, from pars plicator, these green things are coming out. Can you see? These green thread-like things are coming out. These green thread-like things, I have wrongly labeled them as ciliary processes. They are not ciliary processes. In fact, they are known as the ciliary zonule. Ciliary zonules. Okay? Ciliary processes is in fact the name given to the individual plications or folds of the pars plicator. So basically, these individual, if I see, these individually, they are known as ciliary processes. So ciliary processes are parts of the pars plicator itself. They give off ciliary zonules to which the lens is suspended through. Okay, as simple as that. So let's go back and let's quickly write this down. So pars plicator, as I had mentioned here, or rather there, that suppose this is the iris and these things. So this thing was pars plicator. This is pars plicator basically, and these individual things, finger-like things, these are called ciliary processes. And from the ciliary processes, we saw these were ciliary zonules. Okay, simple enough. I hope I have not confused you. I hope I have been able to properly communicate to you what ciliary zonules and ciliary processes are. Okay. Pars plana, on the other hand, was a plain structure, not thrown into any kind of folds, nothing. So a very interesting thing about pars plana is that pars plana is actually relatively avascular. Now this is a very, very, very important piece of information that we have just uncovered. Why? Because of two reasons. First thing, the fact that pars plana, a component of the middle layer of the eye, is avascular, or rather relatively avascular, is kind of a strange thing, because middle layer, uvea, the entirety of it is very vascular, except the pars plana. So if you're ever asked a question as to what is the most, or rather which part of the middle layer of the eye, which part of the uvea has the least blood supply, answer is pars plana, because it is relatively avascular. Secondly, and this is the most important fact, pars plana being relatively avascular means if I were to ever gain entry, if I needed to enter into the posterior segment of the eye, I would have wanted access through some structure which does not have much problem in being pierced. Let me explain this to you in a little bit more detail. So basically what I'm trying to say is, suppose, let's again go back to that picture. Suppose I want to enter this part over here in the eye, the part that I have given a dot. Now we already know from the basic introduction video that this part of the eye is containing the vitreous, and this is basically what? This is the posterior segment of the eye. We know that the part of the eye in between the cornea and the iris is the anterior chamber, whereas between the iris and the lens is the posterior chamber. Anterior chamber and posterior chamber together make up the anterior segment, whereas from the lens to up to the retina, this entire chamber is called the posterior segment. So in many cases, and we will see this later, we will need to enter into the vitreous chamber. Why? To administer some drugs, possibly. It is called an intravitreal injection. Okay. So to enter into the vitreous chamber, the posterior segment from outside, I will need to pierce these structures over here, but I will not want much trauma caused to the eye. So I will need to enter from a site which is relatively avascular, and that is pars plana. So if I basically do this, that suppose I have to enter. This is the injection, the needle. So I would want the needle of the injection to be directed like this. Okay, this is the injection. So I would want to enter through the pars plana. This kind of an injection, this kind of approach is called an intravitreal injection, and there are drugs which are given in this way. We will talk about the different routes of ocular drug administration in a separate video. That is a very interesting topic as well. We'll talk about that later. But for now, what I want you to understand is pars plana, being a relatively avascular structure, provides an excellent and absolutely excellent route of intravitreal injection, intravitreal drug administration. Okay. So because obviously I have to push the injection from outside, right? My only access to the eye is from outside. I cannot go inside the eye and or rather I cannot actually go from some other aperture of the body and reach the eye. My only way of reaching the eye, if I want to actually reach the deeper parts of the eye, is from outside. I have to push an injection. So how will I push an injection? I will have to pierce the sclera. I don't want to pierce the cornea in any way because the cornea is transparent, and any kind of a trauma to the cornea, we have already seen in the anatomy of the cornea that not all layers of the cornea heal. So there can be healing of cornea by scar formation, and that can lead to opacity and blindness or some kind of a loss of vision. So we don't want any kind of a loss of vision. So we want access to the eye in the least traumatic and least dangerous way. That means obviously some kind of a, some part of the sclera needs to be pierced. Where and how, that we will see later when we'll talk about the actual routes of drug administration in the eye. So when that does take place, when we do actually plan for an intravitreal injection, what we'll do is we will pierce the sclera in such a way through the injection, obviously needle of the injection, that we enter the middle layer of the eye via the pars plana, not pars plicata, definitely not iris, okay, and not choroid as well. Pars plana being the most avascular part. So not much trauma, not much blood loss. Okay, so that is a very, very important function of pars plana. That being said, what are the other functions of the ciliary body as a whole? Let me give a function, very, very important function of the pars plicata. See, I had just told that ciliary processes are part of the pars plicata. Well, if you remember, the aqueous humor present in the anterior segment of the eye, that is secreted, as it so happens, from the non-pigmented epithelial cells of the ciliary processes. Very, very important. So the ciliary processes are the structures which secrete aqueous humor. Very, very important function. Okay. Another very, very important function of the ciliary body as a whole that we will talk about in the next video as a whole itself is accommodation. Accommodation. What is accommodation? We will see in our next video, and that is basically a function of the ciliary body itself. So we'll talk about accommodation, the near reflex in the next video, what it is and what all it comprises of. We'll all see to that in the next video. So this basically completes the ciliary body. What else is left? Choroid. Choroid has not much to discuss. So if I just go back to that picture over here, so basically we have talked about the iris, we have talked about the ciliary body, and what is remaining is choroid. Choroid is basically the part of the middle layer of the eye which is covered by the retina in front. As you can see, retina and choroid are just, they're sticking to each other. Where retina ends, that part is actually called the ora serrata. We'll talk about it later. From there onwards, the ciliary body starts in the middle layer, obviously. So choroid is basically that part of the middle layer, and not much is there to discuss about the choroid itself as a fact. So that ends our discussion on uvea. In the next video, we'll talk about accommodation and the near reflex. Okay, hopefully this video has been somewhat helpful to you, and I'll see you very soon in the next video. Thank you.